Hi, this is Mahesh Sangha. I'm a licensed clinical psychologist. Today we are discussing about autism spectrum disorder. It's called autism. So, what is autism? Autism is a neurodevelopmental disorder or developmental disorder. So, its effects in the child, social interaction, communication, and repetitive patterns of behavior. So, today we are discussing about one by one. So, what is social interaction? Social interaction means the child is not able to form a good relationships and lack of attachment with parents, and they doesn't respond the name call, and they are not interested to maintain their age group relationships, and they are treating like people as a objects. These are the social interaction, and it's we can find out the autistic kids before 3 years of age. And we can do next we'll go to the symptoms of communication or delayed speech. Delayed speech means some children can make speech words, single words or single sentences. Some children cannot, the speech is completely delayed. Some children can make babbling and single sentences like mummy, daddy, tata, like this. Some children cannot make sentences formation, like sentence formation means give me. So this kind of formation is not there, and their speech is also not age appropriate. So their speech is delayed and it's not age appropriate. And next we'll go to the repetitive patterns of behavior. Repetitive patterns of behavior means they are doing some kind of activities and they cannot change the routine. Routine means they are they are carrying always one kind of objects, and they are over attachment to the one kind of objects, like their toys of lines, lining up toys, or repetitive activities, and repetitive patterns of behavior also, like clapping hands and body rocking and head banging and self hitting behavior. So these are the behavior issues. So, and they will also equal as speech. So if we ask them what is your name, they also called what is your name. This is called repetitive and speech. And some people acquired speech of lost. So some people grown up is a normal kid, but some children suddenly lost their speech. We can find out it in 1.5 year to 2 years of age. The speech is also lost. So this is called acquired speech of lost, and they does not maintain eye contact. So normal eye contact. Some people the eye contact is completely delayed. Some people can maintain partial eye contact. This is also one of the sign of the autism, and they don't know the what is the edible things and non-edible things. Like they are eating, they are every object is put it in their mouth, and they have some sensor issues also. So sensor issues means like the child, a small loud sound also, small sound also, they can react very big noises. They can react very highly and close their ears. And if you can switch on the light also, overreaction of their eyes. This is called some sensor issues, and they cannot hold the things properly. So, and they have also hyperactivity issues. So hyperactivity means they cannot sit at one place longer period of time. They can move here and there, and very restlessness behavior and tantrums, very rigidity, and they doesn't seems to listen whatever they said. They cannot follow simple instructions, and they have lack of fear of danger. Some people fear of climbing the stairs and climbing the steps also. So these are the symptoms of autism spectrum disorder. And what are the factors of autism spectrum? What are the causes of autism? So because of there are so many factors, it's called biopsychosocial factors. Biological means genetics. Some came from the heredity, and and in previous family anyone had any psychiatric problem, or anyone had close relatives had any issues. And some of the factors, during pregnancy mother had any issues, health issues, like diabetes or hypertension or BP, or mother had any psychological disturbances like any emotional stressors, or any mother had any under medication of psychiatry, any depression. That is also one of the factor. And next we'll go to the age difference. Mother age also after 30, the age also impact one of the There are so many factors, but that is also one of the factors telling now research, current research also, current studies also, and one another factors, the child premature delivery. Premature delivery means before 9 months. So before 7 months, before 9 months. So it's called premature delivery, and the low birth weight and the birth cry was delayed. So after birth, every child can cry, but some children delayed their birth cry. That is also one of the factor, and lack of oxygen. So that is also impact, and seizures and delayed development of milestones, or any jaundice. That is also, or any after neonatal, after birth also child had any birth complications. That is also impact the child. So how can we treat this autism spectrum disorder children? So actually this is the approach of multidisciplinary approach. So first we can find out the diagnosis. So how we can find out the his child is autistic or not? So we consult a professional help, or professional clinical psychologist, or child